Michael. I'm glad we just met and you talked to me about, how important it is not only to have a network, but also to find the right solution for the individual problem. Can you tell me more about it?
Yeah, so I think that's why Wonka is really important to me. I think I've been lucky enough to come to Wonka for more than 5 years, every year, obviously apart from the pandemic. And you build relationships with people from all across Europe, and there's a human aspect to that. And it's great to reconnect with people. And what I get from it is I listen to people and I see the problems that we're facing in every single European country. And guess what? They're very similar. Workload, workforce challenges, burnout, and problems with doing things differently, trying to find our own solutions to the problems that general practice is facing. And that's one of my passions back home. So not only I am involved in the Royal College of GPs, I'm chair of their trustee board, but I run my own practice in the north of England. And I spend a lot of time bringing practices together to do things at scale and try and create solutions to the problems that we're all facing. And sometimes that's possible and sometimes it's not. But when you can find a solution, you can work with your system, whether that's the hospital or local authorities or voluntary sectors, and you work together, you can put solutions in at a big scale. And I'm hoping it feels like that's positive and it is going to have some impact.
Sienna, what I like about you is how you said finding solutions and not only looking at problems. So it's like there's always a way, even maybe you can't imagine the whole way, but you can imagine the first steps, right? So
I think so. I've been lucky enough to do some training in leadership and change management, and one of the key mantras there is start somewhere, go anywhere.
Yeah.
So in these systems that we work in, they're wicked systems. There isn't always a perfect solution. So let's just get together and get behind one solution and then run with it, see where it goes, let it evolve, let it go in a direction that need or the population takes it. And let's not be afraid of that. I think if we're all together moving in one direction, we're going to be stronger. And we involve people in that. Let's hear what people need, what people want, and try and adapt solutions to meet their needs.
So we are a team of general practitioners in Europe, right?
For sure. We're definitely a team of general practitioners in Europe, but I think maybe we should broaden it a little bit. Maybe we should be team healthcare.
I agree.
And
team healthcare is good.
Or team health and social care, involving
yes.
people, patients, GPs, social workers, everyone in the system, hospital specialists, even politicians, right? Because we've got to work together.
Yes.
Yeah, right. Because they've got to help us put in place the solutions that we think are right for our societies, our populations.
Excellent. Thank you so much, Michael. It was inspiring.